screen off. I apologize for that. And all right. And I'll just talk and you can see my slides. You don't need to see me anyway. All right, Youth Mental Health First Aid. Just a reminder to all of you that we are committed to training 350 local and tribal health department staff and your community partners in youth mental health first aid, ideally by the end of the year. So we've got lots of training options. We've talked about this before. I don't need to review it all with you. The options are kind of spelled out on this slide that you see here. We've been reaching out. We've had a few of you reach out to us, so thank you for doing that. We would love to bring these trainings to your communities, to your partners, to your region. However you would like to see that work. We can do fully in-person courses. We can do virtual courses. We can do blended options. There's lots of opportunities for us to bring this work your way. So please do not hesitate to reach out to us if you're not sure where to even start, and but you know you'd like to bring a course to your area. Just reach out and we can help you with those logistics and figure out how we can get a class up and running in your space to train the adults in your space. And again, the Youth Mental Health First Aid Program, for those that might not be aware, is an opportunity to train adults that are working, interacting, living with youth, and finding ways that we can support them, and we can also be aware of signs and symptoms of mental health concerns, as well as giving opportunities to respond appropriately in a crisis as well. So it's an absolutely fantastic program. If you'd just like to learn more, please don't hesitate to reach out to us. Again, we're happy to share more with you. On that same note, we want you to know that we have a statewide youth mental health first aid virtual training opportunity that is being offered specifically for our MCH partners. So all of you and your partners in your communities, we are not marketing this out in a statewide marketing effort because we want this to be very specific to our MCH counties and cities and local tribals departments and the partners that you identify for this training. Our intention is to offer a quarterly statewide virtual opportunity in that blended format. So there'll be 2 hours of a pre-work that is required before the session, and then approximately 6 hours of virtual training that takes place with 2 of our extension educators leading that. We have a registration link. We'll share that out with you, as well as a flyer that will come out with the follow-up email from this particular session. It'll also include the recording from the session as well, which reminds me, we are still recording. Fantastic. All right. I wasn't sure with my awkward disappearance there for a moment if that was continuing. All right. And I also wanted to let you know that our website that we've been talking about, which contains the resource list, it is here. It is available for you to access and to utilize. And within that website, I'm gonna give it a whirl here and try this. Hey, there we go. So hopefully you can still see this. This is what the front page of our website looks like. In the very middle, as you scroll down, you will see the maternal child health, Title V, adolescent well-being, technical assistance space. You're certainly welcome to peruse any other pieces of this website, but this is where you will find the content and the resources that are very specific to this effort that we are involved in. When we open that up, you will be able to see a link to those mapped resources that we've talked about in the past. It also highlights the different areas and resources that Extension provides that can support the work that you are doing related to adolescent well-being in your communities. As you scroll down, you'll also be able to see the learning community call recordings, links and resources. Many of the resources that we've talked about, some of the resources that have been vetted through our Extension colleagues, as well as resources that Maggie has asked that we include in this space for your reference, will be found here. If we continue to scroll down, you'll find our youth wellness team, which is our opportunity to incorporate youth voice in the work that we are doing through the the Patch Youth Advocates work. So you'll find links and information about that, as well as at the very bottom, again, you will find our email address, which is the quickest way to get connected to all of us here at Extension as we work to support you through your MCH efforts as well. So we just wanted to kind of get real excited and shout out that that website and those resources are finally available for you to access. And again, we'll share more information about that as we share follow-up information, and also in our August newsletter as well. All right, I want to pause for a quick moment, see if anyone has any questions for me before I turn it over to Jill and her team to talk about the Center for Patient Partnerships and the fantastic work that they are doing. Oh, fantastic. Yes, I do see a question from Danielle. Go ahead. Danielle, I will follow up with you directly as well. I apologize. I'm not sure why that response did not come, but we will get back to you and we'll get going on that. Thank you for asking. All right. If anyone else has any other questions, go ahead and put them in the chat, but I want to make sure that I turn it over now to Jill Jacklitz from the Center for Patient Partnerships. Jill, I'm going to let you introduce your team and take it away.
Great. Thank you so much. Hi, everybody. Wow, it was, I have to say, sort of enlightening and a bit sobering to hear all of your introductions. I really am sort of thinking of all of you and trying to figure out, what kind of advocacy is needed to sort of help you all build your teams, because it sounds like you all are carrying huge. We are, as we've introduced ourselves. So I'm not gonna go over all of this again. I'm gonna try to be super brief to give the health experiences folks the opportunity to share their great resources. But we are a collaborative. The Center for Patient Partnerships is part of the Division of Extension. The Qualitative Health Experiences Lab is at the Department of Family Medicine, but we have been connected at the hip for 12 years, and so really see ourselves as a very integrated experience. And what we want to talk about today is a little bit about the advocacy work that we do through the Center for Patient Partnerships, so you understand that and see it as a potential resource and ways that it might be a resource in your community, as well as some amazing research that really lifts patients' voices from the health experiences, the Qualitative Health Experiences Research Lab, that really brings real voices into this conversation. And what we really hope that we can get out of this is an opportunity for you all to think about ways that this can be useful in your community, the ways that you might be able to find a way to disseminate and elevate it, if there's ways that we can help you do that. So if you could go to I'm just going to give you a high level on the Center for Patient Partnerships. We are based at the university. We, as you can see here, we do sort of three big buckets of work. We are a higher education program, and it's very experiential. So we have students from across campus, both undergrads and graduate students, doing advocacy with patients, helping them navigate the complex healthcare and sort of related systems that make their lives very, very difficult. And I'm going to talk about that very specifically later. We do systems change through research and policy work. And our real goal is to really bring patients' voices in a meaningful way into conversations, from the exam room and what happens to an individual patient all the way to policy change, that patients need to be at the sort of core of that. Not just at the center where everybody's talking about patients, but that patients are really meaningfully engaged in that work. And one of the most sort of brilliant and concrete ways that we do that is through our partnership with the Q-HER Lab. And so I am going to turn it over to Rachel Grob, Jean Everett, and Brianna Patrick.
Hi, everybody. So as Jill previewed, we thought this morning we would share some tools for the community that come out of our lab. We identify strongly as action researchers. Everything we do is in service of making health and healthcare better by understanding more clearly and through rigorous but also heartful design what it is like for patients, families, and communities, their reality, and harnessing that for change. So that's how we also enhance health and well-being. Next slide. We already did the introductions, obviously. We're going to tell you a little bit about why and how we listen to patients' voices and do that amplification. We're going to spend most of our time on talking about how these resources could possibly be useful for all of you in your amazing work around the state, despite your challenges with staffing, and ways that maybe this can kind of round out some of the youth mental health first aid work that you're already focused on. We're going to give you an example through people's experiences with depression. Jane's going to share that part, and sharing a little bit of a film. So we're going to spend most of our time actually being quiet and listening with you to what young adults have said about their own depression so that we can really illustrate the tool. Stick anything you want to say in the chat. This is our team over in the lab. Everything we do is because of all of these amazing people, some of whom are here today. Brianna is not going to speak today because she's sort of our documentarian, but hopefully get to hear her other times and meet the rest of us at another point. Okay, so our action as action researchers is really focused on using patient narratives because they have such a strong emotional impact. They contain a lot of creative ideas and actionable information. When you interview people about their experiences with health and healthcare, they have rich lived experience and also a lot of ideas for how things can be better. We focus on using maximum variation sampling, as we call it, which just means talking to the widest group of people possible so that we're not always just re-emphasizing the voices that are already loud, and we focus on that representation rectangle here. The resources that we have allow for people to engage and hear about other people's experiences, for example, with depression in the mental health space, without having to look someone else in the eye or disclose their own struggles. So that's an advantage of how we disseminate our work, or some of the ways that we do. And then again, we really try to bring that rigor or the science and marry it with the beauty and power of the narrative so that we know we're not just being swayed by kind of one person's stories, but that sort of voice-to-voice ideas that was on Jill's slide. Here's just really quickly, we can talk about it later, but that, again, that idea of driving narratives from anecdote to science, we elicit very diverse perspectives with every study that we do. The action is in listening to the quieter as well as the voices that are already loud. We do team science to analyze what we're hearing for theme and variation, and then we try to amplify what we hear, which is what we're going to share with you in terms of a few examples this morning. We in the health experiences research that we do, HERN stands for the Health Experiences Research Network that we're part of. And we are designed for educational tools, which we know is something that Extension also focuses a lot on. This morning, we're going to share a little bit about the web-based modules that we publish with video and audio clips and the films that we make out of our research. And we also focus a lot on patient-centered care improvements. So those of you focused in the advocacy space on some of the systems change pieces, as Jeanette mentioned in the intros, that's something that we also do. And before we share the voices themselves, just a couple of examples. We've used our studies and our videos to develop med school curriculum, which we have documented as improving empathy and appreciation for the variation in experiences with mental health in a medical school curriculum. You can see a pub there. We've also, our materials have been used at the Center for Patient Partnership in our own advocacy training in terms of case studies, because there's a lot of narrative data. It's available on the web. You can hear, for example, this woman, Lisa, talking about her issues with breast cancer and other health challenges that she has, and then can walk students through with less hypothetical and more grounding in people's experiences. So these are just some ideas for educational uses. And then there's also the quality improvement or care improvement side. We've been adapting a method from the UK that really puts patients, families, and communities at the center of care improvement. Care improvement, as you all know, can often be focused on sort of the organizational piece. How do we get more efficient? How do we use our resources better? This is about how do we make care more responsive to what we know the experiences of care are for people going through it. And with that, I will turn it over to Jane.
Thanks, Rachel. Yeah, so with that introduction, we wanted to take just a few minutes to walk you a little bit through some of these tools, starting with the website. And for this, we'll take a look together at the depression in young adults topic, but we have other topics as well, so lots to explore on there. So as you can see, when you visit the website, you'll start on this overview page. We have a nice montage of people talking about why they wanted to participate in an interview, as well as a little bit of a description of the study. So you can see that in this project, we talked with 38 young people ages 18 to 29 about their experiences with depression. And then we have a number of topics. So if you navigate over to the left side navigation bar, you can see some of the things that people talked about that then we summarize both in written form and really letting the interviews speak for themselves with a number of different clips pulled directly from people's stories. So either audio if they didn't want to show up on video, or text or video clips. So if we open up one of these, you can see we have content around first experiences of depression, overlap of depression with other conditions, a lot of topics under living with depression, people's experiences of getting help in various settings, as well as helping themselves. And then we always have sections around messages to others, both other people that are dealing with a similar experience and friends and family and professionals. So let's open one of these up to see what it looks like. Here we have one about depression and people's pets. So you can see we have a lot of different video clips that we summarize here. And you can poke through and listen to people's voices, as well as some summary that really present the full sort of scope of everything that we heard in the interviews. So lots to check out there. And we wanted to play just a couple of clips for you all, starting with this one that's about an experience of stigma related to depression in the Black community.
And did you get a diagnosis from your doctors who offered you that?
No, that's why I did not proceed with their help, because I did not want to be labeled. I did not want that in my file at all. So that's where me dealing with it myself came in, because I did not want to be labeled.
Okay. You know, I know that depression has, you know, it's a sensitive topic, and it's in some kind of parts of the culture, it's stigmatized. Mm-hmm. Do you feel that is a stigma?
Definitely.
Yeah. And in your culture particularly?
Yes. It's not something that's easy to talk about. I feel like African Americans and maybe women, I don't know, I can't speak for men, we deal with, you know, a lot, and not having a support group makes it harder, because we kind of have to deal with everything ourselves, or, you know, on our own. And if I would say, hey, I think I'm depressed, it's something that's kind of frowned upon, or something that's
Frowned upon by, like, your friends, your family?
I think
your
maybe
community?
the community. It's not something that's in the norm, I guess you would say. I don't know. I don't think people are educated on it much.
So just a little bit of a taste there of many, many clips that are on the website. Clips around people's experiences of work, along with experiences of things like insurance coverage, that we all know are a huge barrier in the mental health space. So hopefully that's just a very small introduction to lots more to discover there on the website. And our second sort of tool that we wanted to share just a little bit about today is what's called a Catalyst film, which is a 15 to 20-minute film that we create from all of these interviews that we do with folks. And it's really designed to be able to both highlight, as Rachel was saying, sort of the themes across everything we heard, as well as the variation, and has a lot of uses in advocacy and system change and care improvement, and is increasingly something that in the US we are focusing on a number of topics. So look forward to discussing that a little bit more as well. But again, wanted to show you just a couple of snippets of examples here, again, on the topic of depression in young people. So there's first one is a segment that's about people's experiences of patient-centered care and care coordination. And I know the volume was a little bit low in the last one. Hopefully that will be better here, but someone give me a heads up if it's hard to hear.
The purpose of this film is to spark conversations and establish touch points to guide learning or improvement work in a way that is grounded in patient experiences. This film was created using footage from a systematic study that included interviews with 38 young adults living with depression across the country. The clips you will see were selected because they represent common patterns. Participant voices and personal experiences differed, but they shared a belief that speaking up and telling their stories would matter. In some instances, people were eager to share their stories, but were not comfortable being on video while doing so. Not everything you will hear will be directly relevant to your situation, but each story can spark ideas. Companion materials are available at healthexperiencesUSA.org/catalystfilms.
They're great though, and they specifically work a lot with young trans people, so I think it was the first place that I was able to be like, I don't know, fully present in the healthcare, I guess, which probably helped. Also, the person was just really, really kind and yeah, that's normal. It's okay if you can't get out of it. Not okay, isn't that seems fine, but it felt very, very non-judgmental, and also it was one of the first times I didn't feel rushed in a doctor's office. I had questions and whatnot, and the person answered them.
I was given psychiatric medication, yes, but also being a woman and going through menstrual cycles that also affect my hormones and how that would affect my mood and how I would handle medication. So it was interesting because for me, my dialogue with my psychiatrist was, I had to make sure it was in parallel with my dialogue with my gynecologist. And so that's something people should be considerate of as well, because it may be that, you could just, isolate your psychiatrist and just deal with your own psychiatric stuff. But I mean, sometimes that affects other parts of your medical journey, whatever that may be. And so being in a place where you could have your providers work together, or at least be understanding, that's also really important. And it definitely was for me because it made a difference.
Basically, just kind of be held accountable too. I mean, where it's like, okay, well, you know, talk in like 3 weeks. Because, I mean, she could have easily just given me everything I needed like one day and been like, go on your way. But it was the fact that I was like, okay, I'm going to have to talk to this person in like 2 days. Should probably like get some things together.
You're not just a diagnosis, but you're also not just like, you're like far more than a diagnosis. You're a person with like a history and a culture and a family and a support system.
And I wanted to show just a little segment of a second one. This one's about what people want their healthcare providers to know.
I think that depression is an irrational thing, but it has a lot of logic behind it. There's a lot of really valid reasons to be depressed. I think that if you view it as a friend that is trying to protect them, but trying to do it in the wrong way, and show them how that friend is doing that, then you can help them control it, if not get rid of it, because that's still a part of them. You don't really want to get rid of it.
Make them feel accomplished, make them feel independent, make them feel like they matter to society and to their friends and family. That's hard for a professional to do. That's hard for anybody to do. The best thing that I could tell you generally to anyone that is depressed is just to appreciate them.
Young people are scared. They want help. They don't know what to do. And they feel lost, and you're the people they're reaching out to, and that's like a really big deal. And like, just remember that it's a really big deal. I guess that's about it.
With that, I will turn it back over to Rachel for a little bit of discussion of what we just heard.
All right, so these are just some questions that we thought might be interesting to discuss. Do these kinds of websites or films seem potentially useful to you in your work, or can you think of ways that they could be more useful? And yeah, related to that, what other kinds of topics are coming up in your space that we might think about producing tools for if we have the resources that that would help you? So let's just take down the slides so we can at least see each other's boxes. And come on camera if you are able and if you feel like it, and please just dive in with any questions or responses to what we asked, or just responses to the film is also fine, or to the presentation.
I'm going to just get started, and hopefully that'll warm everybody else up to unmute and to share. I won't turn my video on, so hopefully I don't disappear. But one of the things that I think about when I see the work that you're doing, it also always reminds me of an opportunity that we have for education of people around us. And it might be colleagues, it might be other individuals in the community, related to how we define adolescence. And so in a lot of my work in the last 15 or 20 years, I've one of the places that I feel like I have done significant advocacy work is around the adolescent brain development and educating others about really that span. And so I think it's interesting how sometimes we use chronological age to define adult or young adult, but we know that that adolescent brain is still really doing so much development in those early 20-ish years of their life, right? And so while we again often title them young adults, their brains are still not a fully mature adult brain, and the needs that they have still fit within that this adolescent well-being work that we're talking about. And I think I just really, as I was preparing for today, but also then reflecting on what you've shared, that was just really resonating with me as well, how we just sometimes have to maybe remind ourselves, but also remind others around us of those key pieces of brain development that are so important and can really make a significant impact on well-being and decision-making too.
Perfect. Yeah, Danette, I think that's really consonant with what we heard and talking with people in the study. Our brains take a long time to mature into adulthood. Other thoughts, questions, comments, ideas?
I wonder if so one of the things that I often hear is that there's a lot of people can go on the web and find all sorts of materials, right? Like, oh, you want to hear young people talk about depression, just Google teenager with depression and you're going to find a TikTok video or whatever. Why is this kind of approach, what makes it different, and why might us as sort of advocates and professionals turn to tools like this?
Yeah, I mean, I think what makes it different is that it's based on research. It's really reporting out the results of rigorously conducted qualitative research. So it's not just sort of an N of one. And you can hear a lot. Jane didn't go into it as much, but on the website, you could go and pick Tia, who you heard that one clip from, and you can hear a lot from Tia's interview and read a whole biography that's been developed by researchers in partnership with the participants. So there's also been a lot of input and engagement from people in every project. We have many mechanisms for sort of co-design and sharing, as well as for implementation. So I think it's got, sort of reliability and validity, and we want our advocacy to be based on really thoughtful understanding of the issues that we're educating around. And we want our education also to be sharing sort of evidence-based tools, and that is a sweet spot for this work. All right, so feel free to get in touch with us or to stick any other thoughts in the chat. I know sometimes this is harder on the web to really make these connections in a group, but we are easy to find and very happy to be in touch with you. And I will turn things back over to Jill for the last few minutes that we have together.
Thanks. And Jane is thank you, Jane, share a screen. So remember in the very beginning, I talked about the fact that we at the Center for Patient Partnerships do advocacy every day. So that's why I gave us a 10. And we're a little unique and frankly, really lucky to be able to do that work. And I want to tell you about it. And then I want you to know sort of how to get a hold of us, and then invite you to reach out if there are ways that you think that we can be we can get the word out in your community. So we are a center, we're based at Extension. I said we're an educational program, but we have a program that's called the Health Justice Clinic. It's called a clinic because that's what law schools call this kind of work, and we are also affiliated with the law school. It's not a like healthcare clinic, it's super confusing words. But we actually provide direct advocacy services to people who are facing complex health events anywhere in Wisconsin. So people can apply for our services by phone or by email, and I'm going to share that with you. And the idea is that people, as we all know, sometimes struggle with navigating not just the healthcare system, but all the things that come along with the healthcare, with your own healthcare when you are facing a complex health event, insurance, medical debt, employment issues that are related to an illness or something that you're facing. Really understanding your diagnosis and being prepared and building self-advocacy skills as a patient. And then that whole care coordination thing that happens when people are like bouncing from specialist to specialist. Those are the kind of things that we help with. And we actually, as I said, do that through an educational model. So it's graduate students from law, social work, public health, biomedical engineering. I mean, any graduate student that's like, wow, this is really interesting. I want to learn how the healthcare system works. They get to partner with people who call us, our clients, and work with them to navigate these complex systems. Right now, the places where we see the current, like sort of highest areas of need are folks who are facing the Medicaid unwinding and trying to figure out both sort of transition of care as well as what happens if they feel like they are unfairly being cut off from Medicaid. We work with folks to help them figure that out. We're doing a lot of gender affirming care appeals. So folks who are might get an insurance denial for facial feminization surgery, for example, and we work alongside them to file that appeal. Legal issues that arise from the pandemic, which is a pretty broad thing, but we have some funding for that. And then serious and life-threatening diagnoses. And I think it's always helpful to give you a quick example of something. And we have a couple really huge victories recently that I want to share. One is from one of our summer students worked with a family. The kid was 15 years old. He was facing a cancer diagnosis, and they went through an insurance appeal and through their own doctor, and the insurance continued to deny it. And so they went to something called an external appeal to try to get their coverage. And that was under the supervision of our legal services person. Student wrote a magnificent insurance appeal, took it through, and they lost again. And it was really like crushing, right? Because this kid needed this really important resource. And then the student said, boy, I think I know about another, like we just said, keep turning over rocks. This is not the end, just keep turning over rocks. And the student ended up helping the family apply for Katie Beckett. They were approved for Katie Beckett, and Katie Beckett is paying for all of the treatment that was denied by their insurance company. And it's because not only was it that the student did this like good legal work, and she was just reflecting on it yesterday, so it's very fresh in my mind and my heart, but she built a relationship with the mom and the kid. And really, they worked together as a trio to try to figure out how to make those arguments, worked with the docs to try to figure out how to make those arguments, and then worked with the mom to go through the whole application process. So it's really a very sort of partnership thing. And we see that as a really great opportunity for learning for our students, for really serving people across Wisconsin that don't actually often have the opportunity to get connected with somebody who, there's just not a lot. Like somebody said, my colleague said the other day that somebody called our line and he called them back to do an intake, and the person said, oh my God, you called me back. I haven't had anybody call me back. I keep making these telephone calls. So it's really given us an opportunity to, with folks like you, to make sure that people know about this service across the state and get the word out. You could go to the next slide, please. So this is how people can apply, and I can pop it in the chat. And Brianna, I wonder if you could pop those two things in the chat. But so there's an online application. People can call us. If there are ways through your community that you think this information might be useful, we also have information that helps people sort of develop self-advocacy skills around a whole range of issues, how to like prepare for visits with their physicians and all that stuff. We'd love to explore those kind of partnerships with you all. And figure out how to make sure that people across the state, it's really, we have a group of students who sort of have the gift of time and the willingness and the interest to really dig in with their clients and work alongside them. We take what we learn from our clients and we turn it into systems level change all the time.
Jill, it was so impactful hearing that recent story that you said was fresh in your brain about the child going through. Was it a child? The person that was going through
15-year-old, an adolescent, right?
You know, even with good medical care, having that privilege, navigating the insurance system is such a pain. So the work that you guys do is just so important. So thank you for that and for sharing those examples.
Absolutely. Thank you so much, Jill and Rachel, Jane, Brianna, all of you that joined us today, and for each one of you from the local and tribal health departments. We appreciate your participation with us today. We will send out links. We will send out contact information, anything that you need. And again, please don't hesitate to reach out to us through our youth health email. As your technical assistance providers, we are happy to continue to support, make connections, provide resources, whatever we can do to help you continue the work that you are doing. If you're still with us and you haven't completed our survey and our evaluation, as always, we value your feedback. Please let us know what you thought of today's session and what you would like to hear from us moving forward. And with that, again, we thank you for joining us today. And I'm going to stop the recording and let everyone continue on with your day. Have a great day, everyone.